Now comes the disorders of eyelid. First one is ptosis. There will be drooping of upper eyelid, and in resting stage, upper eyelid covers 2 mm of the cornea, and the lower eyelid remains at inferior limbus. So ptosis can be congenital or acquired. In case of congenital, it presents within 1 year of birth, and it involves isolated congenital myopathy and Marcus Gunjo. And next is acquired ptosis. There are 5 types of acquired ptosis. One is senile ptosis, the second is neurogenic, third is myogenic, fourth is mechanical, and fifth is traumatic. So for treatment part, we do surgery only if there will be decreased visual field. So there are 3 approaches in the treatment part. There will be LPS advancement, that is levator palpebrae superioris advancement. There can be a frontalis sling when there is poor LPS action, and Muller's muscle conjunctival resection can be done in cases of Horner syndrome. Next topic is entropion. It is the inward rolling of eyelid against the eyeball. It is of 4 types. One is congenital, which resolves itself with the time. Next is cicatricial, which is due to the scar. Next one is involutional, which is the most common type of entropion. And the last is spastic type. So the sign and symptoms consists of foreign body sensations, photophobia, blepharospasm, epiphora, redness, and discharge. We can do snap back test to access the horizontal lid laxity. The treatment part, there will temporary treatment where lid tapping below lower lid can be done, and everting sutures can be also given on the lid, which is the quickest procedure. And the last one is Jones retractor application. So the next topic is ectropion. In case of entropion, there was inward rolling of eyelid. In case of ectropion, there would be outward rolling of the eyelids away from the eyeball. It is also of 4 types. One is cicatricial, next one is involutional, which is the most common type, and the mechanical and paralytic, which occurs due to facial nerve palsy. So the treatment part, there we do horizontal lid shortening using lateral strip procedure, and retractor reinsertion can be done. So next topic is STI, or it is also known as external hordeolum. It is acute staphylococcus infection of G's gland at the base of lashes, and it is painful, red, hot, swollen eyelid lump, and topical antibiotics can be given, and hot fermentation can also be given. And if it is recurrent, then it can be due to uncorrected refractive errors. The similar type of disorder is chalazion, that is chronic inflammatory granuloma of Meibomian's gland. It is painless, and the risk factors are poor lid hygiene and Blepharitis. So there will be painless lump on the lid, and the treatment consists of hot fermentation, and intralesional injection can be given of triamcinolone, and lastly incision and drainage can be done.